So rosacea is a very common condition, and it's a condition which is often undiagnosed. It can manifest as facial flushing, it can cause facial redness, or it can cause inflammatory bumps or pus-filled spots on the skin. And generally, the approach to treatment depends on the type of rosacea that you have. Patients will often come to the clinic quite late. They may not even have been aware that there are treatments available, or even that they have a medical condition. Now, as for many conditions in dermatology, the first thing to do is to assess what type of rosacea is present. So we've talked about flushing. You can get flat rosacea. You can get prominent blood vessels, which is called erythrotelangiectatic rosacea, and you can get inflammatory rosacea. And with the inflammatory rosacea, you're getting bumps on the skin surface. Sometimes you're getting little pustules, pus-filled spots. Sometimes you're getting thickening of the skin, textural change of the skin. And in extreme cases, this can lead to significant thickening of the nasal skin, which is called rhinophyma. So treatment options are essentially a ladder. So starting from the simplest treatments would be things like creams, ointments, and gels. We would often use things like topical ivermectin, topical metronidazole, topical azelaic acid. They can be effective, but they don't always work for everybody. So moving up the ladder a little bit, we're talking about tablet treatments. Often a good starting point is a 3-month course of an oral tetracycline, such as limecycline. Very safe, very well tolerated, and often that can give you an improvement that can then subsequently be maintained with the topical treatments. So moving on from the antibiotics, sometimes patients may find that either of these treatments are not working, or that they're not getting a long-lasting improvement. And we can discuss more powerful tablet treatment options, such as isotretinoin, which is also known as Accutane or Roaccutane. Can be a very effective treatment, particularly for more inflammatory rosacea. It can give a long-lasting improvement, but it is associated with some risks. And if you come to the clinic, I'll help you to weigh up the pros and cons of this treatment. When we've got good control of the rosacea, then you can find that there is still often some redness which remains. Sometimes you can have prominent blood vessels, particularly around the nose or on the cheeks. They can be very frustrating and annoying, and they're not going to respond to cream or tablet treatments. And this is where the sort of laser and light treatments really come into their own. Vascular lasers, such as the pulse dye laser, really a workhorse for this condition. Other option is the Nd:YAG laser or intense pulse light, which can also be effective. So overall, rosacea is a chronic condition. It's often undiagnosed. We do have effective treatments available, and if you come to see me in the clinic, then I'll help you to understand what the best approach would be tailored to your concerns.